Good morning, everybody. Happy Wednesday morning. Dr. Tyler Hamel, Kingwood chiropractor and nutritionist today, talking about the question that is on obviously everybody's mind when they are having back pain, neck pain, sciatica, headaches, and they come in for treatment is how long is it going to take before I start to feel better? Or how long is it going to take to fix me or get me corrected or better or back to normal or pain-free? And obviously it's different for every patient who comes in because of the condition they're coming in with or the symptoms that they're coming in with, how long they've had it, was it an accident or injury, have they received any care in the past, what have they done, what's worked, what hasn't worked, right? There's lots of different variables to look at when people come in. So I always ask the patient that question just to see if we're on the same page or what page they're on when they come in. So, Mrs. Smith, you've been having neck pain for 6 months. It's been getting progressively worse. How long do you think it's going to take, number one, for you to start to feel better or start to have less pain? And number two, how long do you think it's going to take to correct or fix the problem so it doesn't come back, right? There's a couple things. Obviously, when somebody comes in and they're in pain, they want to get out of pain as soon as possible, right? Like the same day they want to get out of pain. But oftentimes they're not really thinking about correction or long-term. So most of our patients, depending on how long they've had the issue, they'll say, a couple weeks for pain relief and maybe a month or longer for correction. So most people understand that it's a corrective process, right? And I always explain it like this, like obviously we want to get you out of pain quickly and the quicker that happens, the better. But what if we could get it corrected so it doesn't come back, right? Like if you're a golfer or a tennis player or you go to the gym or you like to travel or hike and you have lots of pain, sciatica or back pain, so you can't do those things. What if you didn't have to worry about that anymore, right? So you could do that any time that you wanted. You could go and golf anytime, play tennis, go to the gym, travel, vacation, go hiking, play with your kids. You wouldn't have to worry about is my back going to be able to handle it or is it going to be able to hold up? So I think it's just important to realize when we talk about therapy or treatment, and really even if you talk about physical therapy and acupuncture, things like that, it's a process to go through, and it's never a quick fix. As far as, somebody's had migraines for 10 years. Yes, you can't fix that in 1 week. I mean, that'd be nice if you could, but it's really tough to do. So I think it's just important that, people are on the same page whenever you decide to get any kind of a treatment, whether it's chiropractic or it could be massage or acupuncture, physical therapy, that as the patient, you realize what's it going to take. Because if you're thinking, I'm going to get fixed and everything will be fine in a week, and then the therapist or the doctor's thinking, well, this is probably going to take a couple months, then obviously that's not going to work too well. And I've had patients with sciatica that have taken a couple weeks to get better. I've had patients with sciatica that have taken a couple months. Frozen shoulder, sometimes 2 months, sometimes 6 months, right? So obviously, again, as the doctor, I want what the patient wants, to get them out of pain for sure, but to get them functioning better, right? Like pain is pain. You could take a pain medicine and feel better, but big deal, right? You want to be able to do the things that maybe you're not able to do anymore. Just had a patient come in with hip pain and neck pain, just doesn't want to work out because she feels so bad when she tries to do that, right? So she knows she has to work out and knows you get a benefit if she works out, but she's in so much pain and she's tired and worn out that she just doesn't want to do it. So yeah, I think it's just important to look at that and really think about that before you start treatment of any kind. Or for us, it's chiropractic treatments, it's home exercises, corrective exercises. We have nutritional products, but it's doing that stuff consistently to see the change. And I think for me as a chiropractor, I've done this for over 20 years. Like, I have to tell the patients the truth. Like, this is what you have going on. This is what it's going to take to get you back to playing tennis or golf or playing with your kids. This is what it's going to take to get you back so you can work and enjoy it and make a living and not be miserable with pain or headaches or back pain. And that's what I do. Over the last 20 years, I've seen thousands of patients, and I think they appreciate it when you tell them the truth and, and you don't sugarcoat it. And, you know, it's one of those things, if we're on the same page, the patient and I, we can get some pretty good results in a short period of time for pain relief and then correction later. If we're not on the same page, then we just might not be a good fit, and I can refer them to somebody else. I think that can help them. So again, I'm Dr. Tyler Hamel, Kingwood Chiropractor Nutritionist. If you have any questions about pain relief or chronic back pain, neck pain, sciatica, anything at all, maybe you've tried some things in the past and it just isn't working. And I mentioned that to patients too. If you've done medicine and pain shots and physical therapy and massage and it hasn't worked over time, do you think it's going to start working now if you keep doing the same thing over and over again, right? Even if you're going to the chiropractor for months and months and months. I had a lady call the other day and she'd been going to the same chiropractor for a year, but not really any better, right? Which doesn't make any sense to me, but yeah, so you got to be, got to be on the same page. You got to commit to the treatment, to the therapy. And as the patient and the doctor, you have to realize if it's not working, then you need to refer them to somebody else. So again, Dr. Tyler Hamel, it's Wednesday morning, beautiful Wednesday morning. If you have any questions, let us know in the chat box below about what I talked about today. If you learned something, hopefully what you take away is that there's no quick fix. I know you'll see that all over the TV and magazines and the internet, and click here to be pain-free in the next 24 hours or something garbage like that. It doesn't exist, so don't get sucked into that. But if you have any questions for me, I'll do my best to answer that. If you come in, we have a free consultation to see if I can help you in the first place. It's an opportunity. There's lots of people who haven't been to the chiropractor, who sought out chiropractic care, and they've just been struggling with chronic neck pain, back pain, sciatica, headaches. This gives you an opportunity to come in and at least get looked at to figure out, is this a good fit between us? Am I able to help you? If I can't, I'll refer you to somebody who can. But if I can help you, I'll let you know. I'll break it down. Here's what's going on. Here's what's going to take to get you pain-free, correction, and get you back to get you back to living your best life, right? When you're in pain and you can't do the things that you normally want to do, whatever that happens to be, then that's not a fulfilling life. That's a pretty miserable life, and we're just not meant to live that way. So again, Dr. Tyler Hamel, thanks for watching the video. We'll see you soon in more videos.